Let's talk about some drugs that should not be crushed. Some drugs should not be crushed. Some drugs, the same drug, like this one, let's see, and this one, this is potassium. In some forms it can be crushed. In fact, it even comes liquid. But in other forms it cannot be crushed. If it is extended release, like this is extended release, if it is delayed release, if it is 24-hour, like this one, if it says 24-hour, delayed release, continued release, sustained release, anything like that. And there are almost a dozen different short little letters that they'll put after it. Sometimes they don't spell the whole thing out. They'll just put SR, sustained release. And that is up to you to know that it means that it is a long-acting, sustained release drug that you should not be crushing. Why can't you crush these drugs? Well, these drugs are manufactured in a way that, for instance, this one is delayed release. You're only going to get a small amount at a time. There's several little components and layers in there that come off a little bit at a time and get released into the bloodstream. If you crush it, all of it goes into the bloodstream at one time. Now, can you imagine this if it were a blood pressure lowering drug, an antihypertensive drug? You crush it, you give it to the person. Instead, that amount of drug was supposed to keep their blood pressure low enough for 24 hours. Now, if you crush it and it all goes into the bloodstream at the same time, you're going to make that blood pressure completely bottom out. They can fall, they can pass out, they can get hurt. It could possibly even kill them. So it's extremely important that you read these labels and that you look for delayed release, sustained release, long-acting, extended release. This one is extended release. This one is extended release. This one says 24-hour. This one says delayed release. There's several different things it might say. It might even say LA for long acting. You need to really look at those and understand. Now, what if you tell me, but Diane, my person cannot swallow this big pill anymore. I really have to crush it. Well, you know what? You're going to need to get the nurse to get a new order. Instead of, it is not appropriate for that patient to be getting an extended release medication if it has to be crushed. You'll need to get it in a regular form that can be crushed. Now, this may mean that they have to take 2 or 3 doses a day instead of just 1, but at least you're doing it the right way and you're protecting them and protecting yourself. Now, this one, I have not brought up this one for a reason. This is not long-acting. This is not sustained. This is not delayed. This is enteric-coated. Sometimes they call it safety-coated. The correct term is enteric, E-N-T-E-R-I-C, enteric-coated. Aspirin sometimes will come this way, not always, and other drugs, I can think of a few of them, that are extremely caustic to the stomach. The stomach can get injured pretty easily. And if you have GERD, gastroesophageal reflux disease, it can really burn the esophagus. So these drugs are manufactured, they have a special coating on them. Not all drugs that have coatings on them are enteric coated, only if they say enteric coated. Enteric coating is a coating on a drug that prevents the coating from coming off in the stomach. The pill passes through the stomach completely intact. The coating's still on. The coating is impervious to acid. It will not come off in the acidic environment of the stomach. Rather, the coating comes off very quickly in alkaline, in base, which is your small intestine. So these meds will pass right through the stomach into the duodenum where it is alkalinic, and then the coating will be stripped off. The med will come into contact with the small intestine, and when it reaches the ileum, it'll be absorbed into the bloodstream. So Enteric coated should not be crushed, because once you crush it, you've just defeated the whole purpose. Now that caustic drug is coming in contact with the stomach or the esophagus and can be dangerous. So what else do you think would be important to know about this? Can you think of something else, some other drug you might take that might strip the coating? How about an antacid? Antacid, the opposite of acid. What is that? Well, it's alkaline, it's a base. Yes, something like Tums or Milk of Mag or Mylanta, any of those, is going to strip that coating off right away and expose the stomach to this drug. So you never would want to take, in fact, you never take an antacid with any other drug, but especially not with something that is enteric coated.